It's really important in CLL diagnostics now that we are looking for the TP53 disruptions. And essentially, despite Genomics England and despite many efforts in the last few years, only a minority of patients have got access to testing for both for deletions, missing bits of the chromosome that encodes for the TP53 gene, or for the mutations. And conventional testing requires, FISH testing and Sanger sequencing. These tests become increasingly cumbersome, and we are adding more and more tests to the test repertoire in laboratories. So really the way forward is to modernize genetic diagnostics and genetic diagnostic labs. It's really important for CLL patients that they receive testing every time they relapse before they need treatment, even patients with comorbidities, even older patients. They need to have a combination of deletion testing and mutation testing. And the open question is going forward whether we also have to include genomic complexity as a new predictive biomarker into the mix, because there is now emerging evidence that this might predict lack of response to some of the newer agents. To look for genomic complexity is a complicated matter, and traditionally it's been done by complicated tissue culture tests that are very difficult to standardize. So the answer here, I think, is yes, we probably do need this test in the clinic, but there has not been any standardization. And again, whole genome sequencing, at least in the UK, where we've got the Genomics England program up and running, for the UK that's the obvious solution, is to do whole genome sequencing on those samples.